Good morning. How's everybody doing? My name is Ahmed Al-Muqaddam. I'm a graduate student here at Eastern Kentucky University. I am currently pursuing my psychiatric mental health nurse practitioner's degree. And this is going to be an oral presentation talking about the utilization of mindfulness-based relapse prevention for substance use disorder. I would like to shed light on this topic because it's a pressing issue in the United States affecting millions of Americans. Substance use disorder is defined as a disease impacting both behavioral and brain function. SUDS can manifest as an inability to regulate the use of legal or illegal substances. In the past year alone, over 20 million adults and adolescents in the U.S. reported experiencing some form of substance use disorder, and that is a condition that can both exacerbate mental and several health conditions, and that can be very serious. Unfortunately, the widespread issue has resulted in over 108,000 substance abuse-related deaths. In this presentation, I'm going to address this complex challenge using the theoretical framework known as the Roy adaptation model, and that was pioneered by Sister Callista Roy and Heather Andrews. This is a nursing theory model that views individuals as an adaptive system that responds to both internal and external stimuli. It identifies 4 adaptation modes according to Roy and Andrews. Those modes include physiological, self-concept, role function, and interdependence. By integrating these nursing theories along with psychiatric care, we can empower patients to develop not only healthy response to stressors, but effective coping mechanisms, therefore enhancing their overall well-being and coping methods. Aligning with the Roy adaptation model is the approach of mindfulness-based relapse prevention, or MPRP. It is a promising intervention for SUDS. MPRP essentially focuses on enhancing awareness and acceptance of present moment experiences, and it helps prevent relapse. This approach not only complements the adaptive strategies proposed by Roy and Andrews, but it also underscores the holistic care needed for individuals that are battling substance use disorders. Addressing substance use disorder requires a comprehensive approach with practical interventions such as MPRP, and by doing so, we can strive towards healthier outcomes, improve quality of life for those affected with this pervasive disease. Aligning with the Roy adaptation model is the approach of mindfulness-based relapse prevention, or MPRP. It is a promising intervention for SUDS. MPRP essentially focuses on enhancing awareness and acceptance of present moment experiences, and it helps prevent relapse. This approach not only complements the adaptive strategies proposed by Roy and Andrews, but it also underscores the holistic care needed for individuals that are battling substance use disorders. Addressing substance use disorder requires a comprehensive approach with practical interventions such as MPRP, and by doing so, we can strive towards healthier outcomes, improve quality of life for those affected with this pervasive disease. To go a little bit further in depth, the proposed intervention I'll be mentioning throughout my presentation for substance use disorder, or SUDS, is going to be mindful-based relapse prevention, or MPRP. MPRP essentially is a therapy that integrates mindfulness practices along with cognitive behavioral therapy, or CBT, that's specifically designed to prevent relapse by equipping individuals with essential coping skills to reduce the possibility of relapse. But of the efficacy of MPRP, the research studies provided will show how effective it is. Research by Abid and Shahidi in 2019, as well as Felix Jr. et al. In 2022, underscores the efficacy of the proposed intervention of MPRP. Abid and Shahidi, through their randomized clinical trial study, found statistically significant reductions in desires and intention to use substances, along with relief of anticipation from withdrawal symptoms. Similarly, in Felix et al., which was a systematic review study, reported decreased drug use days and addiction scores among the participants undergoing the MPRP intervention. These studies were further supported by the qualitative research from Dundas et al. In 2020, which essentially was highlighting the early positive effects reported by the patients who were undergoing the MPRP treatments. Now we can dive into a little bit how to use the implementation plan to set this in motion for utilizing NPRP with patients with SUDS. First, you're going to identify and recruit patients. This can be done through referrals, community outreach. You can use collaborations with clinics, treatment centers, and you'll also need to establish an inclusion and exclusion criteria list for the patients to meet. Then you can assemble a multidisciplinary team. This team will include psychiatrists, psychologists, psychiatric mental health nurse practitioners, as well as mental health counselors who all have defined roles to ensure the comprehensive care delivery. We will also develop a clinical practice guideline, or CPG, that will be used to outline standardized procedures for the patient's assessments, interventions, as well as the evaluations. Next is the part where patients will undergo the initial evaluation and assessments by the interdisciplinary team. They will be essentially giving an initial drug abuse screening test, or DAS-10, as well as a UDS primarily, and that will be the baseline marker. And over the course of the next 12 months, they will have a monthly evaluation utilizing the same tools of the DAS-10 and the urine drug screen, and this will be used to effectively monitor and track the progress and the outcomes of the efficacy of the NPRP. Through systematic research and the comprehensive assessments utilizing the DAS-10 and the UDS, we'll be able to document the benefits of the NPRP over the course of a 12-month period. And then from there, we'll be able to assemble a comprehensive article. This article is going to showcase the efficacy of NPRP in reducing substance use and improving overall patient well-being, as well as contributing valuable insight to the field of addiction treatment. Then this article from there can then be disseminated to different outlets to reach a broader audience. For example, the article can be published to peer-reviewed journals, medical blogs, and several digital platforms. Our goal is to contribute meaningful insight to the field of addiction treatment and ultimately improving the outcomes and quality of life for those suffering from substance use disorder. In conclusion, through the systematic implementation of mindful-based relapse prevention and the rigorous subjective and objective evaluations, we aim not only to mitigate the impact of substance use disorders, but to also advance the evidence-based practices in addiction therapies. I look forward to continuing the important work, as well as collaborating with other healthcare professionals and sharing our findings to widely ensure that the effective interventions like NPRP reach those who really need them. Thank you guys so much for your time. Have a great semester.